I think it's almost cliche to say that with respect to the heroin and opioid epidemic that we're all confronting, that we can't arrest our way out of this situation. And while law enforcement efforts are a key part of controlling the access and flow of opioids, those efforts are really fruitless if we don't focus also on prevention, on treatment, as well as enforcement, and on recovery. And like today's panel with the range of subject matter expertise that will be on display before you, the Office of the Attorney General in New Jersey has a unique structure and a variety of expertise housed within it. Within the Department of Law and Public Safety, my role is not only to serve as the Chief Law Enforcement Officer of this state, but also to oversee many divisions, including the Division of Consumer Affairs, the Juvenile Justice Commission, the Division of Criminal Justice, the New Jersey State Police, the Division of Law, the Highway Traffic Safety Commission, and the Office of the Insurance Fraud Prosecutor. And the reason I lay out all those different divisions is because they all play a critical role in curtailing opioid abuse. The Division of Consumer Affairs also houses the boards regulating prescribers and mental health professionals, as well as the Office of Drug Control, as well as the Prescription Monitoring Program. And I'd be remiss, because we're at Seton Hall, and also because he did extraordinary work in this regard, not to recognize my predecessor, Attorney General Chris Perino, under whose leadership we took bold steps across all these different divisions, and within those various divisions, to combat opioid abuse in the state, and several of the efforts that I'll discuss this morning began under his leadership. So I want to recognize him and personally thank him for his dedication, for his perseverance, and for his resourcefulness in this fight. And I'll say this, while those efforts have been working, I firmly believe that there's much more that we can do together to advance the fight against opioids and to leverage the resources that exist across the divisions at the Attorney's office, at the Attorney General's office, and in this room this morning. That's why today I'm pleased to announce the creation of the Office of the New Jersey Coordinator for Addiction, Response, and Enforcement Strategies, or NJ CARES, which will be housed within the Office of the Attorney General. NJ CARES will be responsible for coordinating efforts across our office and creating partnerships with other entities, public and private, who are similarly situated and dedicated to implementing solutions to the opioid crisis and drug addiction. NJ CARES will oversee and ensure coordination between those entities focused on prevention efforts, focused on education efforts, focused on enforcement, focused on treatment, and focused on recovery. And we'll do all that while balancing the care of those in need of pain management as well. And I'm pleased to announce that I've selected Sharon Joyce to be the director of NJ CARES. Sharon is here this morning, and I'd like to recognize her. Director Joyce is an extraordinary individual. She's currently the Deputy Director of the Division of Law and is the Acting Director of the Division of Consumer Affairs. Sharon possesses tremendous knowledge and passion with respect to drug addiction issues and has helped draft and implement many of the regulatory and licensure policies I'll talk about this morning. She's extraordinarily well respected throughout my office, and her 38 years of experience working within the Department of Law and Public Safety will undoubtedly serve us well. And as all of you in this room well know, the coordination that I'm talking about is necessary because the explosion in the opioid and heroin crisis in this state and across the country is really unprecedented. And no individual community, no corner of this state is immune from it. In 2016, in this state, we lost 2,221 people to drug overdoses. That represents an increase of nearly 40% from 2015. And when we look back at data for the previous 5 years, we see a steady climb in drug deaths in our state annually. But the full picture is incomplete unless we look at the statewide administrations of naloxone, the overdose reversal drug. And those are tracked for law enforcement personnel and for EMS personnel. And in 2017 alone, across this state, there were nearly 14,000 reported naloxone administrations, which is double the amount from 2016. But even those numbers really don't capture the full story of the addiction crisis in this state, because naloxone is now available over the counter. And so the numbers that I just shared don't account for administrations by family members, by loved ones, in their home or in another setting. So the true number is far greater than that 14,000 that I shared. But here's the thing. The difference between life and death in this state or anywhere with respect to this crisis should not be the availability of naloxone. It should be preventing the addiction wherever we can. It should be treating those who are already suffering. And it should be providing recovery tools necessary to arm those who struggle with the daily decision to use. Let me share with you a few more numbers to put the scope of this problem in perspective. Some estimates that I've seen also suggest that nationally, 175 people are dying each day from opioids in one form or another. Other reporting estimates calculate that between 60 to 65,000 people died from drug overdoses in 2016 alone. In comparison, more than 58,000 American soldiers died in the entirety of the Vietnam War. Nearly 55,000 people in the United States died from car crashes, which peaked in 1972. More than 43,000 people died due to HIV/AIDS when that epidemic peaked in 1995. And approximately 40,000 people died in the United States as a result of gun deaths, which peaked in 1993. Simply put, the epidemic is unprecedented in its scope, it's unprecedented in its pace, and it's unprecedented in its reach. And as daunting as it may seem at times, as the Attorney General of this state, I'm committed to helping New Jersey overcome this crisis. So on the enforcement front, we are leveraging resources within our office to prioritize prosecutions that will reduce the supply of heroin, will reduce the supply of fentanyl, and other illicit opioids. We're targeting those prescribers and dispensers who operate as drug dealers and flood our communities with pills. And we are enforcing our strict liability statute, a criminal statute that allows us to prosecute drug dealers on murder charges when we could trace their particular product to an overdose death. But again, as I've said before, enforcement's not enough. Another part of our broader strategy involves regulatory change. In this regard, the Office of the Attorney General, working in consultation with the legislature of this state and other stakeholders, has acted to limit the supply of opioids that doctors, that dentists, that other licensed healthcare professionals can prescribe to patients who are presenting to them with acute pain. Under the new rules, treatment providers who wish to prescribe opioids for patient pain are now limited to writing a 5-day initial prescription for pain, down from the 30-day limit that was previously the law. Now, we've also mandated that in addition to rolling back the 30 days to 5 days, that doctors and other prescribers in the state receive training on the addictive nature of these drugs, that they advise patients about how habit-forming they can be, and that they also explain to patients what the pain management alternatives are. These regulatory changes are a vital component of our broader strategy in this fight. So is the New Jersey Prescription Monitoring Program, which is now interconnected with 14 states, and through which excessive prescribing by caregivers is monitored. And with simple searches, prescribers and dispensers can detect doctor shopping by patients and hopefully avoid further abuse. We've also taken both criminal and licensing action against doctors who insist on overprescribing opioids. And we have pursued civil lawsuits against Purdue Pharma and Insys to hold drug companies accountable for what we allege was misleading and harmful conduct aimed at boosting their already lucrative profits from opioids. But away from the courtrooms and away from the boardrooms, where a lot of what I've been talking about takes place, too many people are still finding a way to get their hands on opioids, which can easily lead to addiction and at worst death. Law enforcement efforts to crack down on drug dealing doctors, criminal pharmacies, and others have resulted in addicts now seeking alternative avenues to obtain prescription opioids. The street value of opioid pills today, like Percocet or Vicodin, is almost $1 a milligram, or $30 to $40 a pill, which is prohibitively expensive to sustain over time. So addicts turn to heroin, which in a lot of cases can be had for a few dollars a bag. But the nature of opioid addiction is such that the prospect of being arrested or robbed or ending up dead simply will not deter an addict from seeking that high, or more often, seeking to get well by avoiding the illness that comes with addiction and withdrawal. All of the efforts that I've been describing have a role. Drug enforcement, regulatory control, litigation to hold irresponsible medical professionals and drug companies accountable. But without prioritizing prevention, treatment, and recovery, we won't see any gain. So let me spend the remainder of my time this morning with you outlining some of the initiatives that we are working on in those areas. As the Dean mentioned, she spoke about 2 programs that are very close to me. My office will continue those programs, which we launched in Bergen County during my tenure there. That is first the Heroin Addiction Recovery Team, or HART program, which established walk-in hours at local police stations, where addicts who are suffering from the disease of addiction could walk in and turn in their drugs and could turn in their paraphernalia. And there would be a treatment specialist or a recovery coach present in the police station setting who would help that individual and their family members get the suffering individual into a treatment option. And during those walk-in hours, if the individual changed his or her mind, there was no consequence. But at least they left with an option. They left with resources on how to get into treatment. That's a program that works. We piloted that program in Bergen County in 3 police stations, in Mahwah, in Paramus, and in Lyndhurst. And over the first several months of that program, we had dozens and dozens of individuals walk in and avail themselves to treatment. I think that sort of creative thinking is the future of how we have to deal with this problem. And Prosecutor Coronado is here, and he has a similar program, and it's similarly working. And so that's part of what I want to talk about today, is that we have to really get outside of our comfort zones and think about creative solutions to this epidemic. The second initiative that I want to talk about is Operation Helping Hand. Like the HART program, this involves law enforcement officers taking a different take or approach to addiction issues. Pursuant to this program, county narcotics task forces convene, and they bring together law enforcement officers from across the county. And they engage in these open-air drug sweeps that we're traditionally used to seeing. And in the past, these sweeps would just result in pictures of dozens and dozens of individuals just being put on in the newspaper on the cover, saying that we arrested 100 people who were buying drugs in Newark, or who were buying drugs in Passaic County, or who were buying drugs or using them in Bergen County. And it was this name and shame sort of philosophy that made people feel good that they were doing something about the drug epidemic. But in reality, we were not doing nothing but further stigmatizing those who were suffering from the disease of addiction. So what we did in Bergen County is when we put these task forces together and when we did these sweeps, we decided that we wouldn't do them unless there was a treatment option available for those suffering. And so what we did, and what the detectives did working on that task force, is that they brought in recovery specialists to our office. They brought in licensed clinical social workers to our office, and they prearranged detox beds before that initiative, and they prearranged for treatment options before that initiative. And so when an individual was brought in, they were presented with those options. And we had recovery coaches there who had been clean for a period of time, who could talk to the individuals being brought in and tell them about treatment options and tell them how they were in a similar position and how they availed themselves for treatment and were able to move past their immediate addiction. And so what I'm pleased to share is that in the most recent program we did in Bergen County under this initiative, Operation Helping Hand, during the course of 1 week, 42 individuals were arrested. Of those 42 individuals, about 16 or so took advantage of the program in the first week. Because of the tenaciousness, or the tenacity rather, of the recovery coaches, 7 others availed themselves to treatment in the following week. So a total of about 23 out of the 42 individuals arrested during the most recent Helping Hand initiative availed themselves to treatment. But what I'm pleased to share is that 6 months later, 13 of those individuals were still in some form of treatment. And if you're familiar with the national numbers and treatment numbers in general, you'll know that those treatment numbers are better than what traditional outcomes. And that's proof of concept. That's proof that these sort of targeted interventions by law enforcement can work, that they are better than the alternative, which is really not an option at all, not giving people the tools that they need to achieve their recovery. So it is my hope in the months to come at the Attorney General's office that we will mimic and pilot these programs, the Helping Hand Initiative and the HEART program, in 5 to 6 other counties. And if the numbers are reflective of the success in Bergen County, then it's my plan to roll these initiatives out statewide to all 21 of our counties. I've touched on this in some of my remarks already. A third part of what we will do with respect to bringing treatment relies heavily on the use of certified recovery coaches. Again, former addicts who've stayed clean for at least 3 years and who are trained and certified to respond on an on-call basis when overdose victims survive and are brought to hospital emergency rooms for treatment. We plan to increase partnerships across the state between counties and local hospitals to allow for recovery coaches to be available in hospital ER settings for those who have overdosed. Again, walking out without any options is not an option for me, because too often individuals who are revived using Narcan, as soon as they're medically stable, are released from a hospital. And the next overdose is typically the fatal overdose. And so without these recovery coaches who present treatment options to individuals who are revived using Narcan, I think we're destined and doomed to just be part of that cycle of overdose, recovery, Narcan save, and potentially death. And we're dedicated to breaking that cycle. We're also exploring, and this will please Governor McGreevey, because I know this is a big part of what Governor McGreevey speaks about, medication-assisted treatment plans. That's really the ultimate solution with the full suite of wraparound services. We're looking for opportunities there to increase funding for these types of programs. And in addition to all of the programs that I outlined just now, we intend to use grant funding to assist counties in developing specific opioid response teams, again, made up of law enforcement and crisis management personnel, as well as substance abuse counselors. Grant funding will also be used to make upgrades to our prescription monitoring program and to enhance the ability of law enforcement in New Jersey to collect, to analyze, and to share important opioid-related information, including statistics of deaths, naloxone deployments, and drug seizures. An interagency drug awareness dashboard, or IDAD, will also allow computerized opioid-related information sharing between state agencies. For the first time, again made possible through grant funding, data-informed decisions can be made at all levels. We understand the importance that data plays in the fight, both real-time data and long-term data that allows us to identify trends. That's why for the first time, we will also be making real-time data available through our new webpage. It will provide the general public information on confirmed overdose deaths across the state, suspected overdose deaths, naloxone deployments, and prescription checks made by doctors prescribing opioids through the PMP. We know that there is a desire by researchers, the media, and the general public to have this resource, and we'll continue to add to it and add to the website as additional information is gathered and tracked. And the other thing to keep in mind with sharing data and sharing the numbers with respect to overdoses across the state, in particular overdoses on a county-by-county basis, we hope to draw the stigma away from addiction, because I think too often individuals think that it's not happening in their communities. And by sharing this type of data, we want to draw the stigma and let people know it's happening in their backyards and they need to start having these conversations with their children and family members. Again, as I said at the outset of my remarks, this is a large, multifaceted problem. And in the end, this crisis demands a new way of thinking and responding from all of us. Symposiums such as this one today, bringing all interested parties together under one roof, are necessary and a vital part of the response. And I'm optimistic that by working together we can turn things around and save lives. Another example of the partnership, and I don't know if U.S. Attorney Carpenito is here this morning, but we will also be working with our U.S. Attorney's Office to coordinate a response between law enforcement agencies to target those who run street-level distribution networks, doctors, pharmacists, who might turn a blind eye to overprescribing and phony prescriptions. And I think with these type of coordinated efforts, those peddling misery and destruction in the state should be wary of our efforts. So today marks a new beginning, both in terms of prosecution and policy. As we clean out our medicine cabinets, as we ask questions about our medications, as we hold our children close looking for odd behavior or changes in their personalities, as we change our way of thinking about addiction, about prevention, about rehabilitation, all of us are making a choice. We're making the choice to put lives over stigma. We're making the choice to put hope over death. And we're recognizing that we each have an individual role in this battle. And again, we will win this battle, not because we have no other choice, but because we've made that choice to win. Because we've chosen to move outside of our typical areas of responsibility, because we've chosen to leave our comfort zones, and importantly, because we've chosen to work together collaboratively to counter this epidemic. The governor and I promise that we are committed to changing the course of history and to saving lives, no matter what we have to do, because we too have made that choice. So thank you very much for your time and attention this morning.